Hello everyone, welcome to sqadia.com, and in the second section of our lecture topic, endoscopic surgery in gynecology, we will talk about laparoscopic surgery. And in this we will talk about how we can achieve hemostasis during laparoscopic surgery. What are the indications for the use of laparoscopic surgery, and what are the contraindications and complications? So hemostasis is control of the bleeding during the surgery. Any surgery, usually there are chances of blood loss or due to the injury to the blood vessels. So hemostasis is very important to achieve during any surgical procedure. Different methods are used to achieve hemostasis or to control the blood loss. So some of the common procedures used for hemostasis is electrocoagulation, is the use of electric current to do blood clotting. Coagulation is the blood clot, and once the clot is formed, it stops the bleeding. So electrocoagulation is used to achieve hemostasis. Then again, electrosurgery, monopolar, it can be monopolar or bipolar. Both can be used to control the blood loss. Laser coagulation. Besides electrocoagulation, laser is also used to control the blood loss. Ligature is another method to control blood loss, and seal the vessel fusion. This is done to close the vessel, so blood loss will be reduced. And then we have hormonal scalpel. Scalpel is the instrument to clamp the bleeding vessel. So this is also used to control the blood loss. Then we can have mechanical clips and staples. Staples are also used besides sutures to control the blood loss or to suture the skin. Staples are nowadays very commonly used besides the sutures and ligatures. Then what are the indications of laparoscopic surgery? Indications are the conditions in which we can use laparoscopic surgery. It is further divided into minor procedures and extensive or major procedures. Minor procedures in which laparoscopic surgery can be used is tubal sterilization or tubal ligation, which is the permanent method of contraception. So tubal sterilization is nowadays done by laparoscopic surgery. If there are any adhesions, if there is formation of adhesions or scar formations after pelvic inflammatory disease, after any previous surgeries, and that can lead to complications, those adhesions can also be removed by laparoscopic surgery. Adhesionolysis. Lysis is the breakdown. So breakdown of the adhesions is also done by laparoscopic surgery. Then aspiration of simple ovarian cyst. If there is simple ovarian cyst is a fluid-filled sac. Sometimes needle is inserted and fluid is removed from the cyst. So that is also a minor procedure that can be done by laparoscopic surgery. Then the fourth is ovarian biopsy. If there is suspected ovarian cancer, then biopsy is taken by the laparoscopic surgery. So these four are simple procedure that can be performed by laparoscope. which is again tubal sterilization, adhesionolysis, and then we have aspiration of ovarian cyst and ovarian biopsy. So beside that minor surgical procedure, we have some extensive surgical procedures that can also be performed by laparoscopic surgery, which include endometriosis, so removal of endometriosis. Endometriosis is the presence of endometrial tissue outside the uterus. So different areas endometrium tissue is present, including ovaries, fallopian tubes, and cervix. All these endometrial tissue, in the endometriosis, endometrium tissue is removed by laparoscope. It's a major procedure, not very simple, but it can be performed by laparoscopic surgery. Then myomectomy. Myo is the muscle, removal of the muscle tissue, myomectomy. And then there is retroperitoneal lymphadenectomy. Retroperitoneal means behind the peritoneum. Peritoneum is the lining of the abdomen that covers all the abdominal organs like liver, intestine, stomach. All these organs are covered by the layer known as the peritoneum. Retro means behind. So behind the peritoneum, if there is enlargement of the lymph nodes or if there is involvement of the lymph nodes by any metastasis, those can be removed by the laparoscopic surgery. So lymphadenectomy is the removal of the lymph nodes. Then hysterectomy. Hysterectomy is the removal of the uterus. Again, very, very major gynecological procedure, hysterectomy, that can be now performed by laparoscopic also. Urinary incontinence. If there is incontinence of the urine, like patient has frequent urge to urinate, and if there is any obstruction, if there is any retention, if there is any problem that can lead to urinary incontinence, that can be treated by the laparoscopic surgery. Then sacrocolpopexy, this is also done by the laparoscopic surgery. Sacrocolpopexy, this is on the sacrum, and to bring it down, pexy is to bring the structure down. This is also performed by the laparoscopic surgery. So a lot of procedures now done by laparoscopic surgery, and use of laparoscopy, it decreases the cost of the surgery, increases the fast recovery, and decreases the cost of the surgery and less hospital stay. So it is very, very effective to use laparoscope in different surgical procedures. Then what are the indications of laparoscopic surgery? Why we use it? Again, moderate procedures. We have ectopic pregnancy, endometriosis ablation by diathermy or laser. This is also done by laparoscopic surgery. Different ovary, different things can be treated in the ovary and also in the uterus. So when ectopic pregnancy is present, ectopic pregnancy is the pregnancy outside the uterus. So ectopic pregnancy, most commonly ectopic pregnancy is in the fallopian tube, and less commonly it can be in the ovary, about 0.3% or so. Mostly it's in the fallopian tube. So pregnancy outside the uterus is the ectopic pregnancy. So if ectopic pregnancy is diagnosed, then salpingostomy can be done. which is the removal of the fallopian tube. It can be just a segment resection of the fallopian tube, segmental resection, or it can be complete salpingectomy, complete removal of the fallopian tube. Or it can be salpingo-oophorectomy, in which the ovaries and fallopian tube both are removed. So 4 steps are done for ectopic pregnancy: salpingectomy, segmental resection, or salpingo-oophorectomy. So all these can be done by the laparoscopic surgery. In the ovary, it can be used for polycystic ovarian syndrome, here PCOS. Polycystic ovarian syndrome, in which multiple cysts are produced in the ovary, and diathermy can be done for those polycystic ovarian syndrome, in which cysts can be burned or treated. Then there is drainage of endometriomas. If there is small endometriomas or tumors in the ovary, those can be drained by the laparoscopic surgery. Ovarian cystectomy is the procedure in which cysts are removed, and then salpingo-ovariolysis is the any adhesions or scars between the ovaries and fallopian tube. Those can also be removed by the laparoscopic surgery. In the uterus, myomectomy can be done, which is the removal of the muscle, and then hysterectomy can be done through vaginal hysterectomy, and adhesions can be removed, and all these can be done by the laparoscopic surgery. So a lot of procedures are performed by laparoscopic surgery in the ovaries, in the uterus, and if there is ectopic pregnancy present. Then what are some contraindications of laparoscopy? We went over so many indications in which we use laparoscopic surgery or laparoscopy, but besides some indications, there are also contraindications. Contraindications are conditions in which we cannot use laparoscope or we cannot perform laparoscopy. First is severe cardiopulmonary disease. If they're heart and lung disease, usually laparoscopy should be avoided. Patients who are hemodynamically unstable, with low volume, with low sodium, any problem with the volume, blood volumes, if they are unstable, laparoscopy should not be used. Generalized peritonitis. Peritonitis is the inflammation of the peritoneum. Since we go through peritoneum, through the opening in the peritoneum, so peritonitis is one contraindication of the generalized, especially if involves the whole peritoneum. And then another contraindication is hemoperitoneum. If there is blood in the peritoneum, hemo is the blood. If there is any intestinal obstruction, if there are peritoneal adhesions, extensive peritoneal adhesion, it can block or laparoscopy cannot be performed. That's also a contraindication. If there is large pelvic tumor, any pregnancy, if it's more than 16 weeks, it should not be performed. If there is an advanced malignancy, and if the patient is on anticoagulation therapy, there are chances that patient will bleed more after the procedure. So these are all the contraindications in which laparoscopy cannot be performed. Now, some complications of laparoscopy. All the surgical procedures, whether minor or major procedures, they have some complications. No procedure is usually without any complication. So complications are due to laparoscopy itself, and then we have some complications with the use of anesthesia. Anesthesia can lead to some complications also, and then complications depending on what surgical procedure we are performing through laparoscope. So complications due to laparoscopy itself, there can be injury to blood vessels, injury to bowel, and then injury to other organs beside bowel, and then we have electrosurgical complications, gas embolism. All these are the complications of laparoscopy itself. Embolism is the floating piece that can move in the circulation and can block the blood vessel. Since we put the gas inside to cause the distension, or that gas can sometimes cause embolism or blockage of the blood vessel. And then extraperitoneal insufflation, again, if there is leakage of gas out, then it can lead to outside the peritoneal insufflation. So these were all the complications which are associated with the laparoscopy itself. Then besides that, anesthesia can lead to complications like hypoventilation. Hypoventilation is decreased respiration or decreased breathing, which can lead to hypercarbia. Hypercarbia is increased level of carbon dioxide. So when breathing is less, so we can exhale carbon dioxide, not really very good. So carbon dioxide increased in the blood. So hypercarbia, hypoventilation. So hypoventilation in turn leads to hypercarbia. Then there can be basal lung atelectasis. Atelectasis is collapse of the lung. So collapse of the lung also occur due to anesthesia. All these complications are mainly due to hypoventilation. When breathing is less, it can lead to hypercarbia and then collapse of the lungs. Then complications due to surgical procedure, it can be hemorrhage. Excessive blood loss can occur depending on the procedure. Some procedures can lead to more hemorrhage than the other. Then infection can always be a complication of any surgical procedure. When we enter the body, infection can occur. Then wound dehiscence. Wound dehiscence is the opening of the wound. Later on can occur. And then formation of the hernia. Hernia is the protrusion of the organ through the opening. So whenever there is a surgery performed and opening is there, any abdominal viscera or organ can come out of that opening and lead to hernia. So hernia is the protrusion of the organ through the body. So all these are different complications of laparoscopy. So that was all about section 2, in which we talked about hemostasis, how to achieve hemostasis, indications of laparoscopic surgery, and then contraindications and complications. Thank you for watching sqadia.com.